Jacksonville. Our town is home to some of the friendliest people, tranquil landscapes, and a whole lot of tomatoes. Yet, our community is also home to some troubling statistics, and one in particular is a cause for concern. 1 in 4 children are at risk of hunger every day. Malnourishment has become a major problem for the children of our community, and everyone from county health officials to schools and nonprofits are alarmed at this growing trend. To better understand how children are affected, we met with Christopher Taylor, Executive Director of the Public Health Department in Cherokee County.
These statistics are from what we call the county health rankings. So the Robert Wood Johnson Foundation, in conjunction with the University of Wisconsin, puts out a ranking of every county across the United States. And so if you look at this, what this tells us is that Cherokee County, in terms of health factors, ranks 197th out of 221 counties. So in other words, we have a lot of work to do.
Allison Hale is the director of the Hope Center, a local charity that distributes food and medicine to community members in need. Among their programs is the Backpack Program. This program supplies weekly food packages to at-risk children through local schools. Every Friday, children are given backpacks containing nutritious meals and snacks to keep them fed through the weekend.
The Backpack Program is crucial, especially in this community, because we have so many of our children that are economically deprived, probably higher than any of the other areas that you would see surrounding us. Cherokee County actually has one of the highest levels of poverty in the entire state of Texas.
The East Texas Food Bank provides the food for the Backpack Program, and several times a week, volunteers show up to help assemble the packs. Michael Hetrick is the online communications manager at the food bank.
The Backpack Program is very important to us because it addresses really a big problem in the country, and that's child hunger. Here in East Texas, 1 in 4 children is actually at risk of hunger right now, which is a number that there should not be, because children should be the ones that we're really looking after, because nutritionally, when you have a child who is at risk of hunger, who may not be getting the nutrition that they need, that not only puts their health at risk, but that also puts their education at risk. Perhaps it puts their behaviors at risk. So it's something that we can try to address and really help those kids to get a good start.
School officials have found that some children are particularly lethargic when they return to school on Monday mornings, as the children are unable to rely on school lunches to fill their stomachs during the weekends. Eric Alvarez is a school counselor at Fred Douglass Elementary.
I've had several cases where a kid has been taken to the office because they're distraught, they're acting up. There's not a few times where the kid has said, "I'm just hungry." We have one child, and they'll get on the floor and pick up the crumbs and start eating. The kids go dump their trays, and the child will be waiting there at the end, and he's picking out the food that the kids didn't eat, and he'll just quickly eat it and then get back in line. He's been referred, but we just didn't have any more bags. I've reached my quota for the year.
Mandy Bowen is also a school counselor. She works at Joe Wright Elementary.
Our children have to take care of themselves a lot, and so a lot of times it's that they just can't cook for themselves, even if there is food in the home. And so the food that's in the backpack is food that that's easily ready for them. They can open it and eat it and take care of themselves if they need to. I've been here for 3 years, and each year we've added 2 hours. It's very easy for us to find a child that needs it. We have children that ask, "Can we have a food backpack?" But we don't have enough. And so I think the more people we can tell and share the wonderful stories, and that there is this possibility, I think would be a really good start.
Today, the food crisis is growing more rapidly than the support needed to give each needy child a backpack, and some of our children go hungry. Marianne Lofton, caseworker at the Hope Center, explains.
There's a lot of children that probably need to be on the program. A parent might have lost their job. Maybe the beginning of the school year, the family was doing fine, the parent was working, but situations change week by week, and that there may be children that something might have changed in the family household, and they need to be on there now. And we don't have the room to add that child at this time. It's $157 a year to sponsor a child for the backpack program.
I mean, to think that there actually still are kids out there that we could be helping, and it's just a matter of money. We can't serve every single one that would be able to be served. So it's a horrible feeling for us.
But together, as a community, we can solve this crisis and allow our children a future full of health and opportunity. Help by sponsoring a child today.